In this video, we present a percutaneous spinal needle-assisted suture passing technique for an arthroscopic medial meniscus posterior root tear repair. A 54-year-old female patient sustained an acute right knee injury from a fall, with MRI showing a root avulsion of the medial meniscus posterior horn and weight-bearing radiographs indicating mild medial compartment joint space narrowing with a neutral axis. After the diagnostic arthroscopy, medial meniscus posterior root tear is confirmed. For better identification of the tear pattern, a probe is used. The spinal needle is inserted percutaneously from the posteromedial aspect of the knee. The spinal needle penetrates medial meniscus in the vertical direction and the traction suture is pulled outside the anteromedial portal using a grasper. A 2.0 high-strength non-absorbable suture is passed into the medial meniscus through the traction suture. The same procedure is repeated to insert additional suture into the meniscus. A tibial tunnel guide is then used to ream the 2.4 mm tunnel at the location of the root attachment. The guide pin is visualized arthroscopically to verify correct tunnel placement, and transtibial tunnel is created with a 3.5 mm reamer. Then, a loop passing suture is placed up the transtibial tunnel and retrieved out of the anteromedial portal. All the suture limbs are pulled outside the anteromedial portal using a suture retriever. All the sutures are retrieved through the joint and the transtibial tunnel using the loop passing suture. The reducibility and the correct position of the MMPR are checked. Finally, the root sutures are tied down using a SMC knot over a cortical fixation device, while the posterior root of the respective meniscus is visualized arthroscopically to confirm a secure repair.